I think there needs to be physician education when it comes to this particular problem. And my experience as a congressman before I became governor is I followed these pill mill doctors throughout my congressional district. I called the Ohio Medical Association and I told them what was going on. And their response to me was, "Congressman, we cannot tell our physicians how to practice medicine." And I said, give me a break. There are standards of care. And so I really believe there's a problem. As Governor Nixon has said, I think it's better. I think the physician community, the medical community is becoming increasingly aware that these medications are so powerful and what they can do. And we need some standards of care that the medical community embraces and disseminates to their members. It's a big problem. As I said, it's complex. There's no simple solution, but there are solutions, and one of the solutions is to have a greater engagement of the medical community. We do need the law enforcement community, and we need the entire treatment community. I want to tell you briefly the tale of two nephews. I had two nephews, beautiful young men, wonderful young men. One of them died a few months ago of opioid use. He had been taking Xanax for a long time for anxiety. Then he went to his doctor. He hurt his back. He went to his doctor 3 weeks in a row, got a prescription for opioids, and his sister found him in his bed with his phone in his hand. That's one nephew. Another nephew I had, similar, very, very involved with a lot of street drugs, had gone to the bottom, was homeless and so on. I saw him recently. He was like a different person. And that's because he's in treatment and he's getting Suboxone. And he now has a job. He is in a positive relationship. That shows the power of appropriate treatment. And so we've got to make sure that we have appropriate treatment available for those who are willing to engage in that treatment. As Governor Nixon has said, those on street drugs probably are a little more difficult to engage in that treatment than those that are on prescription medications. But we need an array of treatments available. It's going to take money, and it's going to take resources. But it is a public health crisis, and we've got to admit that it is.